Hi, my name is Hope Beach, and this is a little about me. I'm a junior majoring in kinesiology and pre-occupational therapy. I am interested in working with the child population, such as working in a school or even an early childhood center. I have created a presentation for incoming pre-occupational therapist majors about information on how my 3 theory major concepts can be integrated into my 3 stages of development. My project is related to my major because I will be presenting important information to incoming majors based on the patient's stage of development. My 3 stages of development I will be addressing include infancy, which is the period from birth through the 2nd year of life, early childhood, which occurs between ages 3 to 6, middle childhood, which occurs between ages 6 to 12. My 3 major theories or concepts I will include in my project are attachment, fine motor skills, and Kohlberg's theory of moral development. My first theory is the attachment theory. The attachment theory explains about parent-child relationships and how it influences children's development. John Bowlby is the founder of the attachment theory, and he believes that attachment begins at birth and has tremendous impact throughout life. There are 4 types of attachment styles: secure attachment, ambivalent attachment, avoidant attachment, and disorganized insecure attachment. The parent-child attachment bond shapes children's brains, which influence self-esteem, expectations of others, and ability to attract and maintain successful relationships later in life. This picture I have included kind of explains the 4 types of attachment styles, and the attachment theory is very important during the infancy developmental stage because a child's first 3 years of life are significant in terms of attachment. If a child has a healthy attachment, this means the child can be confident that the adults will respond to the child's needs. If a child does not have a healthy attachment, this means the child associates adults with untrustworthiness. Attachment theory is important for the work of occupational therapy because it is responsible for social and emotional development, communication, and relationships, which is essential for occupational therapists when working with a child to develop specific treatment plans and get the best out of those treatment plans and help in improving their skills. The next concept I will talk about is fine motor skills. Fine motor skills are the ability to make movements using the small muscles in the fingers, hands, and forearms. Children need to use fine motor skills to do daily tasks and many school-related tasks. Children develop at different rates, and there are milestones they generally meet at certain ages called fine motor milestones. For example, at age 5 or 6, children can typically use a fork and spoon with control. Fine motor skills are associated with the developmental stage of early childhood. With these fine motor skills, a child is able to complete tasks such as feeding themselves, writing, and even getting dressed. Developing fine motor skills are important during the early childhood development stage because children with weak fine motor skills see an occupational therapist to help improve their ability to perform activities of daily living and in the classroom. My next theory I will talk about is Kohlberg's theory of moral development. Kohlberg identified 3 levels of moral reasoning: pre-conventional, conventional, and post-conventional. Each level is associated with increasingly complex stages of moral development. He believed that people pass through the stages of moral development in a fixed order as their ability to reason and their sense of justice changes. There are 6 stages he proposed are contained within the levels. And this picture I have included on this side kind of explains